Hi everybody, I'm Dr. Rita Diaz-Carney. I have been teaching anatomy for medical and dental students for many years and I'm loving every minute of it. So my goal with this video is to teach anatomy in a simple, fun way and to make sense of it. Today's video is about the cranial nerves. As you can see, I'm a big fan of visual learning. I hope you have paper and marker on handy. So we have 12 cranial nerves and they are paired. We have right and left and we learn them in Roman numerals, but I will teach in Arabic to make it easier. I like the name cranial nerves because they do originate in the cranial, in the brain, with the exception of number 11 that originates in the cervical spine. So its classification as a cranial nerve is a little bit controversial. We'll talk about the number 11 later in this video. Also, you will notice that the cranial nerves and the foramina they go through when they exit the base of the skull are arranged in order from anterior to posterior, what help us to learn them. Let's start with number 1, right? First thing that you see in your face is your nose. So let's place number 1 right here where the nose is, right? And it is the olfactory nerve, provides sense of smell. It originates in the nasal mucosa, really high in the nose, and bring the smell information to the brain, as you can see in this picture here. It contains only SA fiber, special afferent fibers. It is a special sense after all, right? Smell. It goes through the little foramina in the cribriform plate located at the ethmoid bone in the anterior cranial fossa, as you can see in this picture showing the foramina. But before we proceed with the other cranial nerves, I would like just to share a little extra information about innervation so you have a better understanding of what I'm talking about when I talk about the nerve fibers. The nerve fibers contain millions of neurons. They are the neurocells. And the ones that receive information from sensory organs and transmit this information to the central nervous system, to the brain, they are called afferent fibers with A. And I like to associate the word afferent with a sensor. That means elevator in Spanish. And I imagine that elevator going up and bring sensory information to the brain. So the afferent fibers are sensory neurons, okay? And the neurons that send impulses from the central nervous system to limbs and organs, they are called efferent fibers with the letter E, and they are motor neurons. I like to associate the word efferent with the word effector. It helps me to remember that they cause an effect, they are effective, they are motor. So now we're going to go to the second cranial nerve. That's the optic nerve that I put right here in the iris, number 2. It carries visual message. Number 2, so it's placed right here in the drawing. And the nerve optic neurons, they bring special visual information. We also call SA fibers, special afferent fibers, because vision is a special sense. So special fibers. Afferent because it brings sensory information to the brain, right? Number 2 originates in the retina, goes through the optic canal, and goes through the optic chiasma, as you see in this picture, and goes all the way, the information goes to the occipital lobe, as you can see in this drawing. So it goes to the optic canal. Number 3 now is the oculomotor nerve. I like the name oculomotor, motor, because it provides motor innervation for the skeletal muscles of the eye. The superior, inferior, medial rectus, also the superior oblique muscle and the elevator palpebral. Please see that I put right here number 3 and that is shaking, right in the eyeball there. It contains general somatic efferent fibers. They are, remember, motor fibers, right? Efferent is for motor. Also, oculomotor nerve contains parasympathetic fibers, provide parasympathetic innervation. So it constricts and accommodates the lens of the eye. In this case, they are smooth muscles. So it also contains general visceral efferent, not only general somatic efferent. It originates in the midbrain, as you see in the picture, and goes through the superior orbital fissure, located the sphenoid bone, as you can see in this other picture here. I find interesting the fact that all cranial nerves that innervate structures located at the eye area, they go to the superior orbital fissure, except number 2. Number 2, the optic nerve is so special that it has its own canal, the optic canal. Also, another interesting thing, it's a fun way to remember the oculomotor innervation is use a fake chemistry formula, LR6SO4AO3. LR for lateral rectus muscles innervated by 6, SO for superior oblique innervated by 4, and AO for all other muscles innervated by oculomotor, number 3. We're going to talk about that again. Now I think also is a good time to share a little more extra information about the nervous system classification. Physiologically, we can classify by its function, and we can classify by somatic or autonomic nervous system. The somatic is voluntary. It provides voluntary control of body movements via the skeletal muscle. Most reach conscious level and goes via brain and spinal cord nerves. We control things, we are aware of it. So the somatic fibers can be motor or sensory. The efferent fibers, the motor innervation, goes to the skeletal muscles that are most voluntary, you control. And also reflexive movements like the patellar reflex. And they are general somatic afferent fibers because they are somatic, right? The afferent fibers convey sensory innervation that reach conscious level, like pain, temperature, and touch, and proprioception too. Proprioception, the innervation that informs the central nervous system about the static and the dynamic of muscles and joint positions. I always know how my knee is and my hips and things like this. And they are general somatic afferent fibers, or GA fibers. Now, the autonomic nervous system provides involuntary movements, and usually we are unaware also of poorly localized sensory information. It is provided by some of the cranial nerves and the spinal cord segments. We have 2 divisions, sympathetic, that's fight or flight, and parasympathetic, rest and digest. So they are called general visceral efferent fibers. Visceral means organ and efferent means motor. Involuntary, I don't control these things, right? I don't control the heart, I don't control the glands. The afferent sensory innervation has pain and reflexive fibers. They are involved in local changes in the chemical and mechanical environment of the organ system. They regulate blood pressure, heart rate. They keep our homeostasis, the internal equilibrium in our body. And they are general visceral afferent fibers. Visceral means the organs, afferent is for sensory fibers. Okay, now we're going to go number 4, trochlear. This nerve innervates only one skeletal voluntary muscle, the superior oblique, that goes through a pulley. And pulley and trochlear means pulley, so I really like the name trochlear nerve. I place right here and enjoy it. This is what it does with the iris, with the eyeball. The nerve leaves the midbrain and goes to the also superior orbital fissure to supply the superior oblique muscle. And the fibers are general somatic efferent, right? They are somatic voluntary fibers, efferent because they are motor. Okay? So right here, that's what it does. Number 5 now, trigeminal. Very, very, so I like the name because it has 3 major branches, trigeminal here. So it provides sensory innervation for the whole face, as you can see in the picture. The trigeminal nerve emerges from the lateral aspect of the pons at the middle cranial fossa, and it splits in 3. The ophthalmic division goes through the superior orbital fissure, of course, it goes into the eye, remember? And the green area here in these pictures that you're seeing represents the area innervated by the ophthalmic division of number 5, as you can see. It provides sensory innervation to the forehead, even to the cornea. The eye is in that area too. Also goes through the superior orbital fissure, as the fibers are general somatic afferent or also general afferent, same thing. Pain, temperature, and touch, right? And the blue area now, as you can see in the picture, shows the maxillary division, the maxillary nerve. It provides sensory innervation to the skin and mucous membranes associated with the upper jaw. Also is the general somatic afferent or general afferent, same thing. The division, this division goes to the foramen rotundum, that's also located in the middle cranial fossa. Now you see the picture, the pink color area represents the area innervated by the mandibular division, the third division. And the mandibular nerve provides sensory innervation to the mandibular area. Also is general somatic afferent fibers for pain, temperature, and touch. I know exactly what's going on. And include also innervation to anterior 2/3 of the tongue. That's why I put it here in the tongue, okay? It exits the cranial cavity to the foramen ovale and the sphenoid bone. The mandibular division is the only division that also conveys somatic motor fibers, not just sensory innervation, has motor innervation too. So provide motor innervation to muscles of mastigation, masseter, medial and lateral pterygoid, and temporalis. Also to the anterior belly of the digastric, the mylohyoid, tensor veli palatino, and tensor tympani muscle. They are all skeletal muscles, they are voluntary. So we would expect that the type of fibers would be general somatic efferent, right? But they are not, it's not the case, it's different. The motor fibers in these cases are special visceral efferent, SVE, and not general somatic efferent, okay? So we say special visceral efferent are fibers when they provide innervation to skeletal muscles derived from the branchial or pharyngeal arches in the embryo during the development. So again, in this case, it's SVE fibers, special visceral efferent. Nerve fibers that provide motor innervation to muscles that originates from the pharyngeal arch in humans. Even though they provide motor innervation to skeletal voluntary muscles, they are not general somatic efferent, okay? It's a little bit different in this case, but still voluntary. Number 6 now, abducent cranial nerve. Number 6, very easy one, only innervates one skeletal muscle, the lateral rectus. Another great name, it provides the eye, it moves the eye laterally, causes abduction. So I like abducent nerve, right? That's why I put like this in the drawing. It also goes to the superior orbital fissure, another one. It provides motor innervation to a skeletal muscle, voluntary muscle, right? I move as I want, to the superior oblique. And this one does not derive from the pharyngeal arch, so it is a general somatic efferent fibers, not SVE fibers. We can use the chemistry formula again. Remember the chemistry formula, as you can see, the LR is for lateral rectus innervated by 6, abducent. Now number 7, big one. I call it one of the 3 supracranial nerves because it provides all types of the innervation. It is really super. So I place number 7 here because it provides motor innervation for all muscles of the facial expression. Actually, there is a mnemonic to help to remember the muscles. You probably know that mnemonic already. Is 2 zebras beat my cookie. T for temporal muscle, Z for zygomatic branch, B for buccal, M for mandibular branch, and C for cervical branches. Also innervates stapedius, that's another muscle, stylohyoid, the posterior belly of the digastric tube. So the fibers in this case, these motor fibers are special visceral efferent because these muscles, they derived from the pharyngeal arch, okay? Number 7 also provide taste to the anterior 2/3 of the tongue. That's why I put it here in one of the tongues. So if provide taste is SA fiber, special afferent. See that here where I put the number 7 there in the tongue. The facial nerve also provides parasympathetic innervation to the submandibular, to the sublingual and lacrimal gland, also the area of the nose and palate, mucous glands. So it contains general visceral efferent. Remember that the smooth muscles and glands receive autonomic innervation, involuntary. In this case, it's going to make the gland to produce saliva and also tears. That's why I put in the tear, I put number 7 here, okay? To help you guys remember number 7 that produces the tears. So in my opinion, is the supracranial nerve. Number 7 also, besides all that, provides sensory innervation to the skin of the external acoustic meatus. So it has general somatic efferent or GA fibers. Just to note that the outer surface of the tympanic membrane in this area receives innervation from few cranial nerves. They overlap. So in my opinion, again, number 7 is a supracranial nerve, contain SVE, SA, GA and GVE. Comes from the pons and the medulla area and goes to the internal acoustic meatus, as you can see in the picture. Now number 8, vestibulocochlear. Number 8 conveys sensory input from the organs of the hearing and the balance in the inner ear. It branches into vestibular nerve for balance and the cochlear nerve for hearing. See here where I put number 8 like a earring, so you remember that, okay? It goes from the pons, medulla junction, go via the internal acoustic meatus. There you can see in the picture. The fibers are SA, special afferent fibers. Hearing is one of the special senses, right? Number 9, glossopharyngeal. Another supracranial nerve has all type of fibers. It is motor to only one muscle, the stylopharyngeus. So that's why I put number 9 here with the pharynx, is that area. So it is special visceral efferent because that muscle comes from the pharyngeal arch. So it has that type of fibers. Also provides parasympathetic innervation to the parotid gland here. So it contains general visceral efferent fibers because it's muscles, right? Glands. It also provides taste to the posterior third of the tongue. So it has a special afferent. See what I put here, number 9? And also contributes to the cutaneous sensation to the external ear and posterior tongue. So I put again number 9 here, okay? Notice that, okay? Number 9 goes from the medulla to the jugular foramen, where it exits the cranium. So through the jugular foramen. Now we're going to see number 10, the vagus. That's, in my opinion, the best one. It's a supracranial nerve too, has all types of fibers, and it has the longest course. It provides, number 10 provides motor innervation for all muscles of the pharynx, except the stylopharynx that innervated by 9, all muscles of the larynx. See that I put number 10 right here with the larynx and the pharynx in that area. Also provide motor innervation for muscles of the palate, except the tensor veli palatine, and also innervate the superior 2/3 of the muscles of the esophagus. So it has special visceral efferent because the muscles come from the brachial arch. Also brings parasympathetic innervation for all organs in the thorax, everything, and the digestive system also, up to 2/3 of the transverse column. Also, number 10, besides that, provide taste to the epiglottis and palatal. So, special afferent fibers. See where I put the drawing the tongue. Also provides sensory innervation to the external acoustic meatus area. So, also has general somatic afferent. It leaves the lateral aspect of the medulla, goes through the jugular foramen to exit in the skull. So, exits with number 9 to the jugular foramen. Number 11, spinal accessory. Provide motor innervation to 2 skeletal muscles, the sternocleidomastoid and also the trapezius, via special visceral efferent fibers because they come from the pharyngeal arch. See, I put the number 11 right here, right? And it's originated from the cervical spine. And it goes up through the foramen magnum, has a little bit intracranial course, and exits the skull via jugular foramen with 9 and 10. And that's the reason why number 11 classification as a cranial nerve is a little bit controversial, because it does not originate in the brain, originate in the really high in the spinal cord. Now the last one, number 12, hypoglossal. Hypo means under, glossal means tongue. So this cranial nerve provides motor innervation to the muscles of the tongue, like the styloglossal, hyoglossal, genioglossus, and they are located under the tongue, hypoglossal. And also all the intrinsic muscles of the tongue, the little muscles that start and end in the tongue. See, that's why I put number 12 here. There are skeletal muscles, voluntary, so the fibers are general somatic efferent, motor and voluntary. And number 12 comes from the medulla, leaves the cranium through the hypoglossal canal, as you can see in the picture here, the hypoglossal canal. I like to tell my students that we have 3 tongues, as you can see here, just to learn, because one is for sensory innervation, right, that I have here, the other one is for motor innervation, and the other one is for taste, and you notice here, okay? And that brings us to the end of this video, but before we go, I would like just to give you a little bonus. Sit stable here, and I hope that will help you to remember what cranial nerve have SVE fibers and GVE fibers. Notice that they are almost the same, that number 7, 9, and 10, my supracranial nerves are both. They have parasympathetic innervation, and they also innervate muscles that comes from the pharyngeal arch. Thank you very much for your interest and attention.